Today, the day I am recording this video, marks the official start of the annual enrollment period and the first day that you can actually do something for your 2026 Medicare plans. You may be watching this after October 15th, which is great. This still applies to anyone shopping for a Part D prescription drug plan for 2026. And you are hoping to see what is the lowest overall cost plan for you to pick. I waited to make this video public on October 15th because as of today, you'll be able to go from start to finish, putting in your medications, picking your preferred pharmacies, seeing your 2026 costs, and then actually signing up all the way through the process for that plan that works best for you. I also have some tips on how to make sure that you don't make some serious mistakes while using Medicare.gov. Medicare.gov does update the site regularly, so the pictures or the site may change appearance between right now when I'm making this video and when you are watching this, but the general flow should be the same. You can do this along with me. I have been told I speak quickly, so I will go slower than normal. You can pause at any point or use the setting gear to slow the speed of this video down. Quick disclaimer, if you are on a Medicare Advantage plan, do not go through this process without help. If you sign up for a standalone drug plan while you're on an Advantage plan, it will cancel your Advantage plan. And if you are not already approved for a supplement plan, this causes some serious problems for you. If you are trying to switch from an Advantage plan to a supplement plan and a drug plan, stop. Connect with your agent or broker because there is a very specific order to doing that. And signing up for the drug plan is not the first step. Okay, there are two ways to do this. The first is if you already have a Medicare.gov account, I highly recommend that you get a Medicare.gov account if you don't have one already. It makes all of this very easy, and with your account, you can see an itemized breakdown of all of your Medicare costs as they come up, not just prescriptions, but hospital and medical costs as well. So I'll cover that option first. You have a Medicare.gov account. The second option is if you do not have a Medicare.gov account, you can still see and do everything I'll show you in this video, but it's a little bit more involved. You can skip ahead to the chapters that best suit your needs of whether you have an account or don't. Okay, we'll start with those who do have a Medicare.gov account. Watch how easy this is. Open your internet browser. I am using Chrome. I am in an incognito window because I don't want everything auto-filling with information. Go to Medicare.gov, and in the upper right-hand corner, there is a Login button. Click that. In this left box here is where you will put in your username and then your password. Medicare.gov usually makes you set up what is called two-factor authentication, so when you put in your password, it will send you a text message, and you need to put in that code that is sent to your phone in this box here. Now you are at your Medicare account homepage. From here, you're going to click the Open All Options box, then Find Health and Drugs Plans. This is actually kind of funny because this was a mistake that they had last year and they still have it. I think it should say Find Health and Drug Plans, not Health and Drugs Plans. Both administrations have had trouble fixing this problem. Next, it will auto-populate with your current drug plan and costs. The reason going through your Medicare account is easier is because it is auto-populating your existing medications. You don't have to type anything in. It is pulling the data from your pharmacy claims. Now, sometimes it is pulling in medications that you were taking, but no longer have to. So if you scroll down, you can edit your drug list, and if this is incorrect, you can remove medications or add new prescriptions. We'll scroll back up to the top. Off to the right, click the Find Plans Now button. Choose 2026, put in your zip code, and click Continue. Next, this is a Medicare drug plan tutorial, so click on the Medicare Drug Plan Part D button, and then click Find Plans. They make this pretty easy. At the very top is your existing drug plan and what it will look like for 2026. You may have noticed that this plan was $0 per month in 2025, but it is now up to $9.60 per month for 2026. You can't divide by 0, so there isn't a % increase here, but it is large relative to 0. At the top, there is a Sort Plans By drop-down here. Keep this at lowest drug plus premium cost. Do not change this. This is how you want it sorted to show you the plans with the lowest overall cost to you. As you scroll down, it will show you other plans and their costs. Now notice that the lowest overall cost plan for 2026 in this example is our current 2025 plan. If your 2025 plan is still the lowest cost option for you in 2026, you're done. You don't need to do anything further. Your plan will automatically renew for 2026 and you can relax. You can see that it won't let you re-sign up for your existing plan. This is already done for you. If we scroll further down, the next lowest cost plan is here. It is about $14.72 more for the year than our original plan. Let's pretend that the lowest cost plan for you is this next plan down, meaning that the lowest cost plan is not your existing 2025 plan moving into 2026. You can see that there is a green enroll button and it is now active. If your 2026 lowest cost plan has this enroll button, click it, and that would take you through everything that you need to do to get signed up for that plan to be active in 2026. Now a screen pops up asking you to confirm that you want to make this switch, and it is super easy. I'm logged into a family member's account here, so I'm not going to go past this spot and sign them up for something that we shouldn't. Once you finish the enrollment process, you are done. Your new plan will begin on January 1st, 2026. You will receive your new plan documents before January 1st via mail or email or possibly both. Super easy here. Now I'm going to move on to those of you who do not have a Medicare.gov account. There are some very useful tips in this next part, even for those of you who do have a Medicare.gov account that I didn't cover yet. Just skip in the chapters that says comparing plans. Okay, now let's go over what to do if you do not have a Medicare.gov account, and we'll throw in some higher cost medications into this one. Your first step is the same. Open an internet browser. I use Chrome in incognito mode for this video, and then go to Medicare.gov. You're going to want to find the Health and Drug Plans option in the upper right portion of the screen. Click it once, and it will open the drop-down menu. Over to the left, under Find and Compare, you will want to click the Find Health and Drug Plans button. The reason I go to the upper right corner is because this has stayed pretty consistent over the years. You can also find it here on the home screen, but this has moved and changed more frequently. Over on this right side, make sure 2026 is selected because we are looking at 2026 plans. Put in your zip code. Our family went on a big road trip last year, and the kids' favorite spot was Disney World in Orlando, Florida, so that is the zip code that I'll use, 32830. Click the Continue button. We are going to choose the Medicare Drug Plan Part D option and click Find Plans. This next part asks if you are getting any help with your Medicare health or drug costs. This is specifically referring to official government programs designed for those with low incomes. This does not mean that you have a friend or a family member helping you out with these costs. If you want to know more about what each of these programs are, you can click this little information button and it will open a sidebar explaining each of the programs. I'm going to click I don't get help from any of these programs option and then click the green Continue button. The next screen is asking if you want to see your drug costs when you compare plans, and we absolutely want to see the drug costs, so click Yes and then the green Next button. Now you're going to enter your medications. A quick search tip here is that less is more. If you type out your entire medication name, it opens the door for misspellings and issues finding your medications. So if I'm looking for atorvastatin, I'm not going to type in the full name. I'll start with ATOR, and then it shows up in the list, and I'll just click on it. Then click Add Drug. It's going to ask about your dosage, quantity, and frequency. Make sure you put in the accurate information for you, because if you don't, it completely throws off the costs and which plan would be best for you. Your prescription bottle or tags that come on your medications will have most of this. If not, your pharmacy can help. Once you have that in there, click the green Add to My Drug List button. If you have more medications, click the Add Another Drug button. I'm going to quickly add in some very high-cost drugs just to point out some important aspects of the 2026 drug changes. This is not necessarily an accurate depiction of a real-life person, just throwing in some high-cost, common drugs here so that if we have a pharmacist watching and freaking out because these drugs interact poorly with each other, this is just to get high-cost meds in here. Lantus is insulin for those with diabetes. Diflurazone is a cream to treat skin conditions like psoriasis. Symbicort is an inhaler for asthma and COPD. Notice this one asks if I want to look at a generic alternative. Generics will cost less, but we're using the brand. Eliquis is to prevent blood clots, and Xarelto is another blood thinner to prevent blood clots. Again, we are prompted with generic or keeping the brand name. All of these have very specific dosages, packaging options, and frequency aspects that you have to get right, or else it'll throw everything off. Things like tablets versus capsules versus extended release or ER versions, they matter. Double check on creams or ointments or gels and how often you need refills. Okay, you can pause here if you are still adding your medications for yourself. Once you have all of your medications and prescriptions in there, click the Done Adding Drugs button. Next, you can pick up to 5 pharmacies. I always check mail order. I highly recommend you pick 3 different pharmacies, and I mean different brands of pharmacy chains if they are chains. Even if you like Walgreens, don't pick 3 Walgreens locations. Pick Walgreens and then a different brand like CVS or any other local pharmacy that you like. Click the box next to the pharmacies that you want to compare. If you don't see your preferred pharmacy, there are multiple pages to scroll through, or maybe you need to change the drop-down to be a larger area rather than 5 miles. Or you can type in your pharmacy name in the search field. Add at least 3 and up to 5 pharmacies, and once you have your preferred pharmacies selected along the bottom, there is a white button in the lower right that says Continue to View Plans. Click that. Here is where the fun happens. The next screen will have all of the Part D plans available in your area, and it is already sorted by lowest drug and premium costs. Keep this sorted like that. Don't change the drop-down because you really do want the lowest overall cost plan for you. A couple of things you need to notice in this example. First, notice how the total costs for you with these medications are well over the $2,100 max out of pocket that is in place for 2026. Well, we can see that not everyone has a $2,100 cap, and there is an important reason. You can click on the Plan Details button to see what is going on. Then click on the Drug Coverage tab. Notice that all of the pharmacies are in-network pharmacies, with some being preferred in-network. But when we get down to the drug costs, we see that the difluorosone cream is not on formulary. It is not covered. I think I also had an entire tube every month, which would be a lot. In other videos, I've discussed how important formularies and tiers are. If a medication or a brand is not on your drug plan's formulary, first, you are paying the full cost of that medication out of your own pocket. And second, that dollar amount does not count towards your $2,100 max out-of-pocket limit. So you could see higher than $2,100 in out-of-pocket medication costs even in 2026. In this case, you'd want to work with your doctor to find a similar medication that would be on formulary for you. Okay, I'm going to go back and remove that just so that we have an example where all medications are on formulary and show you something else. You can go back and edit your entries. I'm going back to the drug list and I am deleting the difluorosone cream. If you forgot a medication, you can always go back here and add another. Okay, now we see our total cost on the lowest plan available is under that $2,100 limit. If you had this drug list and you lived in this zip code, here is the plan that you would get. I may take some heat for this, but on drug plans, the star rating really isn't as important as it is with Advantage plans, but that's for another video. All right, this plan has a $25.90 premium. You are paying this each month just to have this plan. This is why it is so important that you keep your plan sorted by lowest drug plus premium cost. Look at the other plans here that have higher or lower premiums. You want that $115.90 per month premium plan, even though it costs you more overall? Probably not. You want a $0 monthly premium plan, even though it'll cost you $23,000 more for that year with your drug costs? No, thank you. We can jump into the plan details to see why. The $0 premium plan does not have Lantus and Symbicort on formulary. The $25.90 per month plan does have them on formulary. This is a general statement and not always true, but typically those lower cost Part D plans in the $0 range have more restrictive formularies, as we can see here. Going back to the lowest overall cost plan and looking at the plan details, this section is the yearly cost by pharmacy, where you can see that the pharmacy you use does make a difference. I think it's also interesting that the preferred in-network pharmacies are not always less expensive than just regular old in-network pharmacies. There aren't huge discrepancies or differences in this case, but in others there will be major differences. And then the next section is my favorite. It shows you your estimated cost in each month of the year. You can see that you're hitting your max out-of-pocket drug costs in August with all of the pharmacies, so you have no more costs from September onward for on-formulary medications. It's nice to know which month you will hit this if it applies to you. It is also a warning for those of you who hit your max out-of-pocket in 2025 and you aren't having any drug costs right now towards the end of the year. Everything resets on January 1st, so you will see a higher cost month in January with deductibles and the max out-of-pocket being reset. Going back to the list of plans, you can compare different plans by clicking on this little Add to Compare box. Let's compare, and let me draw your attention to these two higher premium plans. Notice that both have an out-of-pocket cost to you in excess of the $2,100 max out-of-pocket. I told you how non-formulary medications do not count towards the max out-of-pocket, but all prescriptions are on formulary for these three plans. So why are two of them more than $2,100? That's because the monthly premiums to have the plan do not count towards that maximum out-of-pocket number. These monthly premium costs are on top of or in addition to the max out-of-pocket cost. Okay, let's wrap this up with comparing plans and getting enrolled. You've found the lowest overall cost plan. In this case, it is this first one. Premium costs are here. The deductible differences are important as well. The deductible amount is a dollar amount that you pay first before your plan starts to help out. The two high premium plans don't have a deductible for one and a lower deductible on the other. The $25.90 plan almost has the max deductible amount for 2026. The max is $615. This one is only $601. But this is again why it's important to sort this list by drug plus premium cost, not sorting it by deductibles, not sorting it by monthly premiums, because you could have a plan with a higher deductible that is still a lower overall cost plan for you than a plan with a lower deductible. Now you will need to pay the $601 towards your drug costs, and then your plan would kick in using this drug plan as an example. With most of these plans, Tier 1 generics are covered before you hit the deductible. We can see which plans have which medications covered and on formulary. In this case, they all have all medications on formulary. We can also see which pharmacy will give you the lowest costs with each plan option. These pharmacy costs are estimates, and they can change throughout the year. This is a big variable here, and picking pharmacies here in October, November, December, or whatever month you're looking at this, based on the cost that they show here on Medicare.gov, is the option that we have. But know that pricing can change throughout the year by medication and by pharmacy. These prices can and do fluctuate. So in our make-believe example here, this first plan is the lowest overall cost plan, and you can actually enroll from here. Or if you did not do this whole compare feature, back on the regular list of plans sorted by lowest drug plus premium cost, you can enroll from here. Before you do though, this is super important. If you are already on this plan, meaning the company and this plan is the one that you have right now in 2025, and it is still the lowest cost plan for you in 2026, you are done. You do not need to re-enroll through Medicare.gov. You don't need to do anything. Your 2025 plan will automatically renew for 2026 as long as you are current on your premiums. If the lowest cost plan is not your 2025 plan and you have found a different plan that is lower than your existing plan, you would click this Enroll button. A box will pop up here confirming that you actually want to enroll in this plan. Click Join Plan. You will be asked to put in your Medicare number that you can find on your Medicare card. Now, this is as far as I can take you because I don't have a Medicare card for myself yet, and I am not enrolling anyone for realsies, but the process is straightforward and simple. You can see that there are 7 steps, and that's it. You did it. You can finish this all by yourself, and you will receive your documents in the mail or via email or both from your new drug plan before January 1st. Remember, if you make a change, the new plan begins on January 1st. You still have your old plan through the end of the year if you're signing up in 2025. Now, here are my final thoughts. If you pick a drug plan now, but something happens next year and you need a medication that is not on your drug plan's formulary because you didn't know that you would need it when you signed up for this plan, you can apply for formulary exceptions with your drug plan company. I can't guarantee that it will be approved, but there is a process involved where you can try to find a solution to this specific problem, and we have seen many get approved for examples like this. If you are considering moving from a standalone drug plan and a supplement plan to an Advantage plan, that is a different process. Connect with your agent around this. It is much more involved and the decision-making process is different. Also, if you are looking to move from an Advantage plan to a supplement plan, maybe because your Advantage plan went away and you can do that now with guaranteed issue rights, that is a different process, and the order is very important. I have a checklist for that situation in the description of this video. I hope this tutorial was helpful for you. What I think is great about this is that you can see exactly what your agent or broker sees. Brokers and agents are getting harder and harder to get to help with Part D drug plans because of what insurance companies are doing on the commission side of things. But if you are looking at supplement plans or Advantage plans, there's a lot of extra data that an agent can bring in to help with that decision. But with drug plans, it really is this simple. Last tidbit of advice. Get started now. Don't wait until December 7th or the last day of the month before you need this coverage to start if you are going on Medicare outside of this annual enrollment period. Get this moving early. Mistakes can be fixed between now and December 7th, but on December 8th, you don't have that same luxury. YouTube thinks that you will really like this video next. Happy annual enrollment period. I will see you over there.